And the distraction, again, is we just want to separate joint surfaces, right, in kind of a pure longitudinal way. I can do a couple things. I can take the arm here, and I could go in and palpate, find her notch, go over and say, okay, I think somewhere in here I'll be able to feel that node. I'm hoping not too much, but I'm not. There we go. Are there gaps? So that is easy to do, right? It's just an armhole. You could be more subtle with it. And go, all right. Now I could walk around and tug the other arm, but I could also try it this way. You come in, find that. I could come in here and hook this part of the shoulder and take it over and fill a gap. Okay? But it has to be that way. You don't want to shove it down. You want to take it that way and feel it. Okay? All right? So I could do that and just get a simple distraction. Now, the SC joint is not something I do a lot of times the first time unless they have had a clavicle fracture and they're just, coming out of that kind of thing, and it might be stiff and you might jam that joint up. So I usually do the pronohumeral, I get the posterior glide, the inferior glide for sure. But again, there may be a case with certain kind of injuries I would do this first. But a lot of times what happens is I wait and you're not getting the full range. You're missing that last 30 degrees or whatever it is, and I think, well, maybe it's this contribution or this contribution that's not allowing me to get that last little bit, and then I would come to this. But you might do it earlier in the case of a clavicle fracture or something like that. Now, you can do anterior, posterior glides. I don't know if that's going to help us.
No, okay, sorry.
I'm going to be kind of here. So, anterior, posterior. The anterior is probably the more uncomfortable one to do, and the reason is it's hard to get under there and lift it up. Right? So I think, sometimes what helps, I think I'll be able to get under her here, but I'm going to try to put this pad and get it kind of under the clavicle so I can lift it. All right? So I think I can sit down on this side pretty good here. So if I come under, I'll be monitoring over here where the thing runs out, and I'm going to just lift that way. And out. So sink under, lift up, and down.
Can you feel that, Barbara?
So again, it's hard to make that comfortable because I'm trying to pad and hit with this. You don't want to come in and dig them with a knuckle. And you're trying to get, because this is a bone and superficial, there's not much cushion there. So I'm going to be against the bone. I'm trying to get that padded there if I want to pull anterior. Now the nice thing about this is this is not usually a direction I worry about too much. Because what's the mechanics of this, guys, right? I just had all that kinese. When my shoulders are this way, which way is the glide going to go here? Anterior. So most people are forward head, and they're probably setting anterior. You don't need to worry about them moving more anterior. What you probably want them to do is get their shoulders back, their scapula back, and you want them to be able to retract. And that needs a posterior glide in that plane, right? So I usually am a little bit more concerned about the posterior versus the anterior. And what's nice about that, now McGee will show you coming up and doing the posterior, putting the thumb by the joint, coming down, and you can maybe try to monitor that too if you want with the other finger, but I can come down and just push that posterior. And that's going to feel more yummy than getting in behind it and trying to lift it up, okay? And even a better way to do it, I learned this one in my fellowship, I kind of like this handling, is I could come down and just let this cross the clavicle, right? And so I could come in and just come in this way, and now I could monitor if I wanted all of this, but now I got a nice pad, and that feels much better, I think, than even the thumbs do. So from the posterior glide, which is the one I might want to do more often because I want scapula retracted and work on the middle stuff, I can do that. It'll be fairly comfy. Okay. You can try to get under and superiorly glide it. And I'm going to get this out of the way. And get under. A couple other treatments I'll show you here in a minute. But we can drop under, and trying to get under this is a little tough. But I can try to take that uphill. try to take it that direction. And you may have to hunt around to a place where you think a lot of your thumb will rest, and you'll be able to go that way. All right? Again, not a good way to do this, but what's the deal here? How often do I need that way? What do shoulder problems, what do the shoulder people have trouble doing? Going overhead. So what do I really need? Inferior. Right. So typically, I'm doing this one, and then I'm going to come in here and get on it, and I'm just going to take it down. So I can let the thumb rest on the top of that clavicle and just coax it down, right, by just kind of going that way. And that's a little less grievous than trying to get under again. So the ones that are hard, thank God we don't have to do often. They usually are not as interested in it. Now, a couple things you could do to make this a little easier. Up in the shirt. But I could put a bunch of stuff here, just relax, and lift that away from that. If I curl that shoulder up and had that on a pillow, I might be able to get behind there better. So if I had her this way, I might be able to sink under there a little bit more and then lift up. So sometimes that works if you've really got to check that direction. At the biggies, I think you'll be able to do this way and ride your thumb into the, and that'll help you with the elevation piece and the retraction piece, which is usually the biggies that you want. But practice the others just because they'll be fun to hurt each other. But work on your skills, and it might be the case where you have to do it. But usually it's not those directions. But see if you can get hooked in behind there. And I think we'll let you practice that one, since those are a little bit of a handful.